Did you know that the very medical tests meant to monitor your health might actually be destroying your lungs right now? It sounds almost impossible to believe, but 3 common medical procedures you've likely undergone could be silently damaging your ability to breathe properly. What's truly alarming is that thousands of Americans undergo these tests every single week without ever being warned about their potential dangers to lung tissue. These are routine exams your doctor has probably recommended multiple times without mentioning their hidden risks. The good news is that after watching this video today, you'll not only discover exactly which tests to be cautious about, but you'll also learn the simple protective measures that can safeguard your lung health before permanent damage occurs. Because when it comes to breathing freely, you simply can't afford to wait until symptoms appear. Every breath you take depends on healthy lungs, and today, we're making sure yours stay that way for years to come. Take a moment right now to notice your breathing. That gentle, automatic rhythm that brings life-giving oxygen into your body with each inhalation. Most of us only appreciate this miracle when something goes wrong. Perhaps you've recently found yourself becoming winded after simple activities that never troubled you before. Maybe you've developed that persistent cough that seems to linger for weeks, or noticed an unexplained shortness of breath when climbing stairs or carrying groceries. If so, you're far from alone. Countless Americans are experiencing declining lung function without understanding why, and it's deeply unsettling to feel your breathing capacity diminish without explanation. What makes this situation particularly troubling is that many people assume these changes are simply part of getting older, never suspecting that routine medical procedures might be contributing to their respiratory difficulties. We trust the healthcare system to protect us, not harm us. That's why this information is so vital, especially if you're over 60 and receiving regular medical care. Your lungs are incredibly resilient organs, but they're also uniquely vulnerable to certain types of damage that can occur during common diagnostic procedures. The frustration many patients feel is completely understandable. You've done everything right, you've kept up with your regular checkups, followed medical advice diligently, completed all the recommended screenings, only to find yourself struggling with unexplained breathing issues. It's like carefully following a recipe only to have the dish turn out wrong every time. What's worse is that once lung damage occurs, it can be extraordinarily difficult to reverse completely. That's why prevention and awareness are absolutely critical. Today, we're pulling back the curtain on 3 common medical tests that could be compromising your lung health without your knowledge. This isn't about creating fear or panic, but rather empowering you with information that many healthcare providers simply aren't discussing with their patients. Because your ability to breathe easily is precious, and you deserve to know everything that might be affecting it. Let's understand why your lungs are particularly susceptible to damage from medical procedures. Your respiratory system works with remarkable precision but also surprising fragility. Each time you breathe, air travels through an intricate network of increasingly smaller passages until it reaches tiny air sacs called alveoli, where oxygen enters your bloodstream. This delicate system can be easily disrupted by radiation, chemical agents, and other elements present in certain diagnostic procedures. The first test we need to discuss is the CT scan with contrast agents. CT scans deliver significantly more radiation than standard X-rays, sometimes equivalent to hundreds of chest X-rays in a single procedure. While these scans provide valuable diagnostic information, they come with considerable risks to lung tissue when performed repeatedly. The contrast agents often used during these scans to improve image clarity can trigger inflammatory responses in lung tissue. These substances can cause allergic reactions in sensitive individuals, leading to inflammation and breathing difficulties that may persist long after the scan is completed. The radiation exposure from CT scans can damage the DNA in lung cells, potentially leading to inflammation and scarring of lung tissue over time. This damage doesn't always produce immediate symptoms. It can develop gradually over months or even years after exposure, making it difficult to connect the breathing difficulties you're experiencing now with a scan you underwent last year. By the time symptoms become noticeable, significant changes may have already occurred within your lung tissue. The consequences of this unrecognized damage extend far beyond physical discomfort. As breathing becomes more labored, your entire quality of life can diminish. Activities you once enjoyed, dancing at family gatherings, playing with grandchildren, working in your garden, become increasingly difficult. The psychological impact shouldn't be underestimated either. The anxiety that comes with struggling to catch your breath can be overwhelming and isolating. Many patients report feeling trapped in their own bodies as their breathing capacity diminishes. That's why understanding these risks now is so important for protecting not just your physical health, but your overall well-being and independence. Now let's examine our second concerning procedure, bronchoscopy. This examination involves inserting a thin tube through the nose or mouth to examine the airways directly. While this procedure provides invaluable diagnostic information for lung conditions, it carries risks that patients should be fully aware of before consenting. The process of inserting the bronchoscope can introduce bacteria into the lungs, potentially causing infections in these sensitive tissues. Additionally, the procedure itself can trigger bronchospasm, a sudden tightening of the muscles around the airways, leading to wheezing, increased mucus production, and difficulty breathing. What makes this particularly concerning is that these symptoms are often mistakenly attributed to the condition being investigated rather than recognized as side effects of the procedure itself. This misattribution can lead to additional, unnecessary treatments that fail to address the true cause of the new symptoms. I recently spoke with Martha, a vibrant 68-year-old who had always prided herself on staying active despite her age. After experiencing mild chest discomfort, her doctor recommended a bronchoscopy to rule out serious conditions. Within days of the procedure, Martha developed a persistent cough and shortness of breath that significantly limited her daily activities. For months, doctors treated her for various respiratory conditions without improvement. It wasn't until she consulted with a pulmonary specialist who recognized the timing of her symptoms that the connection became clear. The bronchoscopy itself had triggered an inflammatory response in her sensitive airways. With the right treatment approach focused on reducing this specific type of inflammation, Martha saw significant improvement within weeks. The third procedure we need to discuss is nuclear medicine ventilation scans, commonly called V/Q scans. These tests are used to check for blood clots in the lungs and involve inhaling a radioactive aerosol while receiving an injection of radioactive material. While the radiation dose is typically low, the inhaled radioactive substances can irritate the airways and lung tissue in sensitive individuals. This irritation can trigger coughing, wheezing, and shortness of breath that may persist for days or even weeks following the procedure. What's particularly troubling about all these tests is that patients rarely receive complete information about these potential risks before consenting to the procedures. A recent survey published in the Journal of Patient Safety found that fewer than one-third of patients felt they were adequately informed about the potential side effects of diagnostic imaging procedures. This information gap leaves many people unprepared to recognize warning signs or take preventive measures to protect their lung health. The good news is that there are effective strategies for minimizing these risks without foregoing necessary medical care. For CT scans with contrast, ensuring proper hydration before and after the procedure can help your body process and eliminate the contrast agents more efficiently. Discussing alternative imaging options like MRI, which doesn't use radiation, may provide the necessary diagnostic information without the associated lung risks in some cases. For bronchoscopies, asking about preventive measures such as pre-procedure medications to reduce inflammation can significantly decrease the risk of adverse reactions. Additionally, keeping a detailed medical imaging history can help you and your doctor track your cumulative radiation exposure and make more informed decisions about future tests. Being proactive about infection prevention by ensuring all equipment is properly sterilized before procedures can also reduce risks significantly. Some patients have found benefit from respiratory strengthening exercises recommended by pulmonary rehabilitation specialists both before and after undergoing these procedures. What's important to understand is that knowing these risks doesn't mean avoiding necessary medical care. These tests save lives when used appropriately. It's about ensuring that the benefits truly outweigh the risks for your specific situation, and that all reasonable precautions are taken to protect your lung health during necessary procedures. By having informed conversations with your healthcare providers, you can become an active participant in protecting your respiratory system while still receiving the diagnostic care you need. Leading pulmonologists have been raising concerns about these issues for years, though their warnings haven't always reached the general public. Dr. Thomas Reynolds, Chief of Pulmonary Medicine at Eastern Regional Medical Center, explains that the cumulative effect of multiple diagnostic procedures on lung health is something we're only beginning to fully understand and appreciate. The evidence suggests we need a more cautious and individualized approach, particularly with elderly patients and those with pre-existing respiratory sensitivities. Research from the American Thoracic Society has revealed that patients who undergo multiple imaging procedures involving radiation within a short time frame show measurable changes in lung tissue samples. These changes include increased inflammatory markers and alterations to the delicate alveoli structures responsible for oxygen exchange. While these changes don't always lead to immediate symptoms, they can make the lungs more vulnerable to other stressors like air pollution, respiratory infections, or additional medical procedures. Traditional medical wisdom has always emphasized the importance of protecting the lungs from external irritants. Ancient healing traditions across cultures recognize the lungs as particularly vulnerable organs requiring special care and protection. In traditional Chinese medicine, for instance, the lungs are considered especially sensitive to external influences and in need of gentle strengthening. Modern scientific research is now validating some of these age-old concerns about respiratory vulnerability. What many patients don't realize is that healthcare providers themselves often take precautions that aren't extended to patients. Radiologists and technicians step behind protective barriers during radiation procedures, wear monitoring devices to track their exposure, and follow strict guidelines limiting their occupational radiation exposure. Yet patients, particularly elderly ones, may undergo multiple scans without similar monitoring or protective considerations. This discrepancy in safety standards is something every patient should be aware of when considering their medical care options. The medical community is increasingly recognizing that a more personalized approach to diagnostic testing is needed. What's appropriate for a young, healthy individual might carry significantly greater risks for someone with pre-existing respiratory issues or advanced age. This shift toward individualized risk assessment represents an important evolution in how the medical community approaches diagnostic procedures, particularly for vulnerable populations like seniors. You might be wondering why this crucial information isn't more commonly discussed during your medical appointments. The answer reveals something surprising about our healthcare system. The time constraints of modern medical practice often mean that discussions about procedure risks focus primarily on immediate, common side effects rather than potential long-term consequences to specific organ systems like your lungs. Additionally, the compartmentalized nature of healthcare means that the doctor ordering your CT scan might not be the same one treating your unexplained cough 6 months later, making it difficult to connect these events. Here's the revelation that many patients find truly shocking. The benefits of these diagnostic tests are calculated based on population statistics, not individual risk profiles. This means that while a procedure might be broadly beneficial for the average patient, it could pose significantly higher risks for certain individuals with specific sensitivities or health conditions. The decision to proceed with these tests often doesn't adequately account for these individual variations. Another eye-opening fact is that medical facilities are not required to track patients' cumulative radiation exposure across different healthcare providers and systems. This means that if you receive imaging at different hospitals or clinics, there's no centralized record keeping track of your total radiation exposure over time. The responsibility falls entirely on you, the patient, to maintain these records and advocate for your lung health across multiple healthcare settings. The most alarming aspect of all this is that some of the damage to lung tissue from these procedures may be permanent. Unlike some organs that readily regenerate, lungs have limited regenerative capacity. Once certain types of damage occur to the delicate alveoli or bronchial structures, full recovery may not be possible. This permanent nature of some lung injuries makes prevention absolutely crucial for maintaining respiratory health throughout your later years. What's particularly concerning is how these risks can compound for elderly patients. As we age, our lungs naturally lose some elasticity and functional capacity. When this normal aging process is accelerated or complicated by procedure-related damage, the impact on quality of life can be substantial and far-reaching. Every breath becomes more precious when breathing itself becomes labored. Understanding these risks and taking steps to protect your lung health can bring profound psychological benefits beyond the physical improvements. Imagine the peace of mind that comes with knowing you're making truly informed decisions about your healthcare, actively participating in protecting your ability to breathe freely. There's a special kind of confidence that develops when you transform from a passive recipient of medical care to an informed advocate for your own respiratory health. For many people, breathing difficulties create a constant background anxiety that colors every experience and interaction. Even simple pleasures like attending a grandchild's recital or meeting friends for dinner can become sources of stress when you're worried about becoming short of breath. By taking control of your lung health and minimizing unnecessary risks, you can reclaim these joyful moments without the shadow of respiratory anxiety hanging over them. The social benefits are equally significant. When breathing is easier, you're more likely to remain active and engaged with your community. The isolation that often accompanies chronic breathing difficulties can be prevented or reversed when you maintain healthy lung function. Think about the conversations you can enjoy without pausing to catch your breath, the walks you can take without worrying about becoming winded, the laughter you can share without triggering a coughing fit. There's also an emotional resilience that develops when you feel in control of your health decisions. Rather than feeling at the mercy of confusing medical recommendations, you become a partner in your healthcare, equipped with knowledge that allows you to ask informed questions and make decisions aligned with your personal values and health priorities. This sense of agency is particularly important as we age and face increasingly complex healthcare choices. Remember that feeling we talked about at the beginning, the simple pleasure of a deep, easy breath? By becoming aware of these potential risks and taking steps to minimize them, you're protecting that fundamental experience that so directly connects to your sense of vitality and well-being. The freedom to breathe easily is something many people only truly appreciate once it's compromised. By acting now, you're ensuring that your respiratory health remains a source of strength rather than limitation in the years ahead. As we wrap up this important discussion, let's quickly review what we've covered today. We've examined 3 common medical tests that could potentially harm your lungs: CT scans with contrast agents, bronchoscopies, and ventilation perfusion scans. We've explored how these procedures can affect your lung tissue, sometimes with delayed symptoms that make the connection difficult to recognize without specialized knowledge. But more importantly, we've discussed practical steps you can take to protect yourself while still receiving necessary medical care. Keep a personal record of all imaging procedures, particularly those involving radiation or contrast agents. Before agreeing to any test, ask your doctor if there are alternative diagnostic options with fewer risks to lung tissue. Ensure that proper infection prevention protocols are followed for any equipment that comes in contact with your airways. Stay well hydrated before and after procedures involving contrast agents or radioactive materials. And perhaps most importantly, don't hesitate to discuss your specific concerns about lung health with your healthcare providers. Remember that this isn't about avoiding necessary medical care. These tests save lives when used appropriately. It's about ensuring that the benefits truly outweigh the risks for your specific situation, and that all reasonable precautions are taken to protect your lung health during necessary procedures. The time to act on this information is now, not after you've begun experiencing breathing difficulties. Lung damage often develops gradually, with symptoms appearing only after significant changes have occurred. By then, reversing the damage becomes much more difficult, if not impossible. This is especially crucial if you're already scheduled for any of the tests we've discussed today. Before proceeding, have that important conversation with your doctor about your specific lung health concerns and how to minimize potential risks. Think about what's at stake here. Your ability to breathe comfortably affects every aspect of your life, from your physical capabilities to your emotional well-being. It influences how fully you can participate in the activities you love and connect with the people who matter most to you. That's worth protecting with every tool at your disposal. I urge you not to wait until your next medical appointment to begin this important conversation. Make a list of the imaging procedures and lung-related tests you've undergone in the past few years. Consider whether any patterns in your respiratory symptoms might correlate with these tests. Prepare specific questions for your healthcare provider based on what you've learned today. Taking these simple steps now could make a tremendous difference in your breathing comfort and overall quality of life for years to come. Your lungs sustain you with every breath, every minute of every day. They deserve the best protection you can provide. And now that you have this information, you're empowered to give them exactly that. Because breathing freely isn't just about physical health, it's about living fully.